Are you in the room? I know there's a lot going on in the world right now with the economy, inflation, people losing their jobs, Elon Musk versus Trump right now. It's a lot, but we're not here to talk about them. We are here to talk about HIV awareness, okay? Now you're probably thinking, oh my God, that's old news. Everybody knows about HIV. No, some of you have children that are promiscuous, you know them, or maybe they're a little bit naive, or maybe you yourself are getting ready to go for a freaky weekend. I don't know. All I'm saying is I want you to have HIV on your mind. The number of HIV cases in many states is still going up. We're just not talking about it. And as a medical provider, you hear things and you have access to things. Not only HIV, to be honest, but STDs, gonorrhea, syphilis, herpes, it's still out there. I don't know why people are acting like this stuff is not there. It's still there. So I need you to listen today, please, even if you think you've heard this information before, because we're going to talk about some of the statistics. I have like the numbers and talk about, the symptoms, but also the treatment and etc. But really, the point is, I want you to have a conversation with your child or with your grandchild or whatever young person that you have in your life, just reminding them to be careful because this stuff is still out there and these young people are dying. I'm not exaggerating when I say there are a lot of young people dying of HIV, and there are a lot of people who are getting HIV and don't even realize that they have HIV.
The cause of death for celebrity hairstylist Jesus Guerrero, who worked with Kylie Jenner and Jennifer Lopez, among other stars, is revealed. 3 months after the celebrity hairstylist died while battling an illness, his immediate cause of death was ruled pneumonia and cryptococcosis, a fungal infection with acquired immunodeficiency syndrome, as the secondary cause, according to a County of Los Angeles Medical Examiner's Office report viewed by E! Following the celebrity hairstylist's sudden passing, Kylie and Jennifer were among those who attended his funeral in Houston March 30th, according to multiple reports. The Kardashian star also covered expenses for the service. In a social media post just after his death, Kylie paid tribute to Jesus, saying in part, "He was a light in my life, a source of laughter, comfort, love, and unwavering support. I don't know how I would have made it through the last almost decade without him by my side." She then directed her words toward him, saying, "Thank you, Jesus, for always being there for me, for lifting me up, for being my friend. The pain of losing you is just unbearable, and I don't know how to move forward without you. But I know great grief is born only of great love, and I loved you."
Now, some of you may have listened to the story and felt like it wasn't relatable to you in some way. Maybe, you're thinking, oh, what has this got to do with me or my family? Maybe you're thinking I'm a female. Maybe you're thinking I'm heterosexual. Maybe you're thinking I have safe sex or my grandchildren do, whatever. But guess what? He could have been any one of your children. He could have been any one of your grandchildren. He could have been you. Quick refresher. What exactly is HIV? So big picture, HIV is a virus that attacks your immune system and makes you vulnerable to other infections. So there are stages. So for example, HIV stage 3 is what we used to call AIDS. AIDS, acquired immunodeficiency syndrome. AIDS, that is actually stage 3 HIV. And that is exactly what the young stylist passed away with that I shared earlier. Okay, so in the United States, there are about 1.2 million people in the United States who have HIV. And 13% of them, which is not a small number, 13% is what they're saying approximately of those people don't even know that they have HIV and need to be tested. Now, I was looking back at the numbers for 2023, which was only 2 years ago, right? Less than 2 years ago, 2023. And I was looking specifically for my state or where I live, North Carolina. And I suggest you do that for yourself too. In 2023, North Carolina had about 1,400 new HIV and AIDS diagnosis. Wow, the numbers have gone up. Black and African Americans experience the highest rates of new HIV diagnosis. And they believe that some of that may be linked to delayed diagnosis and also due to, the period of the pandemic. Now, over 36,000 people are living with HIV. At the time, they said 20% of those people don't know their status. So can you imagine? So they're walking around, they're sleeping with people, they're having relationships, they're passing it on, and you don't know that you're getting infected, or your children or your grandchildren. You need to talk to them. So big picture, the odds of you getting HIV depends, of course, on your individual risk factors, right? But for the average person, of course, your risk of getting HIV depends on your sexual risk factors or your history, drug use, sharing needles. And when we talk about specifically types of sex, anal sex carries the highest risk of transmitting HIV or transmitting the virus. So obviously, there are different types of sexual activity, but anal sex carries the highest risk of transmission, which doesn't mean you can't get HIV from vaginal sex, because obviously there are a lot of women who have HIV and have only engaged in vaginal intercourse. Individuals with HIV who have a high viral load are more likely to transmit the disease, which is why it's so important to find out early or to get tested early so that you can get on treatment. And the goal is to get your viral load to undetectable, to as low or undetectable as possible, because then you're less likely to transmit the disease. So people who maintain an undetectable viral load will not pass on HIV during sex, which is why it's so important that they remain undetectable by taking their medication. And also, people who use a condom properly every time, and that's what you need to emphasize to your young people, who use a condom every time, not just once in a while, not with that person that you suspect, but every time, significantly lowers their risk of HIV transmission. And then even with a relationship, if at all you suspect that your partner is not monogamous, and maybe you are pregnant, because pregnant women can pass HIV to their babies, please get tested. Pregnant women can pass HIV to their unborn baby, called vertical transmission. And so pregnant women should also be tested for HIV. And this is not about fear mongering. This is not about just giving you negative news. I'm honestly just trying to motivate as many people that, are sexually active. Pregnant women can be sexually active, right? So just trying to remind you. But on a positive note, even if a woman is pregnant and happens to be HIV positive, at least here in the United States, you can take HIV medication while you're pregnant and lower the risk of your baby having HIV. Of course, usually, once the baby is born, the baby is also given HIV medication for 4 to 6 weeks. And therefore, that will lower the risk of a baby getting HIV. The risk will be lowered to 1%, which is amazing. Because I remember, again, as a younger person, when HIV first came out, it felt like an absolute death sentence because they didn't have the medications that they now have. I'm sure if you grew up in the 80s, you remember the horrifying headlines, the pictures, the protests, all the people that were passing away. It was a very scary time. And thank God for science. Thank God for all of the advancements that have been made and all of the new medications that are now available, which is why it's so distressing that despite all of these advancements, so many countries around the world continue to be plagued by HIV, including sub-Saharan Africa, which carries the highest global burden of HIV and AIDS, with an estimated 67% of the world's people living with HIV reside in this area, sub-Saharan Africa. Obviously, there are different reasons for this, including access to medication, funding, education overall, and I'm not going to focus on that in this video. When you look specifically at how funding has been cut by the current administration, that is also going to make things even worse and a contributing factor. Now, of course, the dynamics in the United States are completely different than some of the issues dealt with in sub-Saharan Africa. However, HIV is still an issue here. What are the symptoms of HIV? Fever, chills, night sweats, rash, swollen lymph nodes, flu-like symptoms, sore throat. But it's important to say that you cannot rely on those symptoms alone, because sometimes those symptoms might mean something else. Just having those symptoms don't necessarily mean you have HIV, right? You can have those symptoms and it be something completely different. So really the point is that the only way to know for sure that a person has HIV is to get tested. Get tested. HIV can affect anyone. It doesn't matter your ethnicity, doesn't matter your religion, it doesn't matter your gender, it doesn't matter your sexual orientation. Heterosexuals are picking up HIV. Homosexuals are picking up HIV. Okay? Women are picking up HIV. Men, children. So see, it does not matter. So we all need to be informed and protect ourselves. So how is HIV transmitted? HIV is transmitted through blood and other bodily fluids. So it can be semen, pre-semen, breast milk, vaginal secretions, rectal secretions. As we know, there's a lot of misinformation out there. HIV is not transmitted through sweat or through tears or through casually hugging a person or even kissing a person. You cannot get HIV through casual interaction. You cannot get HIV through the air, through water, through toilet seats. No. Again, bodily fluids, including blood. It's also really important to note that HIV transmission only happens when a person with HIV who has a detectable level of HIV passes their bodily fluid into the person who doesn't have HIV. That's the only way to get an infection, which is why it's so crucial that if a person has HIV, they get tested, they see their doctors, and that they are on medication or that they are being treated. But how will you know if you don't get tested? How will they know if they haven't been to their doctor, if they're not being tested? Also, keep in mind, a person can get HIV without having sexual intercourse. Perhaps they are having sexual activity. There is a lot of skin-to-skin contact. If there is an open sore and the person has HIV and has detectable levels of HIV and they have a sore or you have a sore and there is contact, exchange of blood, then you can get HIV. Or if there is a breakdown to the mucous membrane in your mouth or that other person's mouth, you can get HIV from there. So if there's a breakdown of the mucous membrane in the mouth or in the vagina or in the tip of the penis or rectum, then you can pass HIV or be infected with HIV. All right, let's talk numbers. I have my notes, okay? Because I want to give you accurate information. All right, 39 million people worldwide are living with HIV, at least as of 2022. Isn't that crazy? 1.5 million of those people were children under the age of 15. 5.5 million did not know they were living with HIV. 1.3 million contracted HIV in 2022. So the point of this is that I want you to hear that there are a lot of people, literally millions around the world, contracting HIV every year. So for those of you that travel or have young people that travel, that have sexual activity outside of their home or even maybe in their hometown, there are people with HIV right now that don't realize it. Let's talk about HIV based on race and ethnicity. By race or ethnicity, Black and African Americans, okay, in the US make up about roughly about 12% of the population. So roughly 12% of the US population is Black or African American. Yet they account for at least 37%. Imagine that. Almost 40% of the new HIV cases and people living with HIV are Black or African American, despite the smaller numbers when it comes to how much space we take up in the US. White persons make up 61% of the US population, but account for 27% of new infections. Hispanics and Latinos make up about 24% of HIV infections, new HIV infections. So together, Black and Hispanic or Latinos make up more than half of the new HIV cases, 70%. This is specifically from 2022. And in the South, these numbers continue to go up. So the South accounts for half. When we're talking about the US population, the South accounts for half of the new cases of HIV infections. Let's talk specifically about categories. 67% of all new HIV infections were among male-to-male sexual contact. Keep in mind, these numbers have declined since 2018. And again, keep in mind, women still account for at least 18% of all new HIV cases. So you don't have to be engaged in a male-to-male relationship. There are people that are homosexual, there are people that are bisexual, there are people that are undercover having relationships with, the same gender and are actually married and having relationships with you. There are all kinds of combinations of people. So again, women account for almost 20% of the new HIV cases. And in fact, people who acquired HIV through heterosexual relationships or contact made up 22% of those new HIV cases. So here are the overall recommendations by the CDC. If you are concerned about HIV, get tested. The CDC recommends that if you are over the age of 13 to the age of 64, you should get tested at least once. Now, of course, there are many other recommendations out there that suggest you should get tested a lot more than once. But at least at a minimum, know for yourself that you've been tested at least once. I can't tell you how many times I've been tested, but whenever the opportunity comes and I am asked, would you like to be tested? I say, yes, please. Go ahead and test me for HIV and whatever else you want to test me for. Because the more information I have, the better. And the safer it makes me feel. And in turn, the safer it might make my partner feel. Number 2, talk to your doctor. Number 3, protect yourself. And always use a condom properly. If you are sexually active, if you are out there in these streets, use a condom properly. If you want to significantly lower your risk of HIV. I don't care how clean they look, how rich they look, what story they told you. If they are sexually active before you or is potentially sexually active with you and other partners, you better know your status. Because the longer you don't know, the higher your chance of getting from HIV to AIDS. God forbid. Avoid sharing needles. Obviously, I don't need to tell you that. You already know that. Consider taking PrEP or pre-exposure prophylaxis if you know you're going to be with someone that is high risk. This does not matter whether you are male or female. Pre-exposure prophylaxis. This is something, when I think about, again, years ago, was not available. Now they have this available, and it's lowering the risk of getting HIV. Nowadays, you can also get post-exposure prophylaxis. This is medication that you can take if you believe that you have been with someone that is high risk and you want to eliminate your risk of getting HIV. So PEP or PEP must be taken within 72 hours of exposure to prevent the virus from taking hold of your body. So I hope this discussion resonates with someone. I hope it reaches someone. I don't know, I just felt, again, this strong desire to have this discussion with you. Please protect yourself. Please talk to your young people that are around you. Remind them HIV is still out there. And then, of course, all these sexually transmitted diseases, herpes, gonorrhea, chlamydia, and some of them are becoming resistant to the treatments. So that's another subject. Some of these sexually transmitted diseases are becoming resistant to the medication. In other words, the medication that is typically prescribed is no longer working. So please be careful out there. Be careful. Bye.